We are going to talk a little bit about the Washington State ICD10 collaboration, and I am going to introduce my colleague, Bill Campbell, to come up and talk about this. You may not recognize him in his... That's right. Come on up. Okay.
It would be great if the panelists would join me
Yep.
too, so I don't feel lonely up
Yep.
here.
I'm here, Bill.
Okay.
I'm here for you. Come on up. And by the way, for one of the panelists, it looks like, speaking of prizes, somebody left glasses.
Well, that might be actually mine.
Oh. Can I keep them as a souvenir? No, okay. There you go. Thanks. Come on up. Oops, sorry. There you go.
Okay, I'm Bill Campbell, not to be confused with my alter ego, Will Campbell. He hangs out with the celebs. Me, I hang out with the subject matter experts who really run the world. Okay. So what I want to do today is talk a little bit about this Washington State collaborative that's going on that you may or may not be aware is happening. So they're doing a couple of things. The first that will happen is starting in December 3rd, there's going to be what we call the ICD10 Progress Sharing Brown Bags. We call it a brown bag because it's being done over lunch. Get this, you know, you bring your lunch, you eat your brown bag. There'll be conference calls from 12 to 1. They will be scheduled for the first Tuesday of every month starting December 3rd. The idea is we will have a set of topics that will be defined ahead of time. Some organizations, 4 or 5 organizations who are working through that, will do a report out of what they're doing on that topic. And then there'll be general questions and answers. So it'll be 1 hour. General information will be provided about what these organizations are doing on a given topic, and then questions and answers from the people participating in the phone call. If you're interested in participating in that, go to the slides, and on the slide you can send your contact information that you're interested, and you'll get an email from me that will talk about kind of what the topics are going to be, and you can pick and choose which topics you want to join in on. So this is a pretty good opportunity for people that not quite sure how to move forward with ICD-10, and you can hear how other people are doing it. So it's just an opportunity for you guys to learn more about what people are doing for ICD-10. So that's one of the things that is happening for the collaborative. The second thing that's happening for collaborative, and I think Karen had mentioned it, there's a work group that meets monthly. Work group started with 12 people. There's now 35 people involved in the work group. And what that work group is made up of a number of provider organizations, 14 provider organizations, 10 payers, both local and national, 4 clearinghouses in both the associations. And what this work group is really focused on doing is what are the information resources that are really necessary for providers. So we work to develop those, but post those for everybody to have access to. So what I want to do now is kind of go and show you where these resources are, how generally to use them, but not to the degree that we're going to really spend a lot of time because there are too many of them. So, Rick. Nice, huh? Okay, so everybody knows the One Healthport website? Great. Okay, on there, what you may not notice is on the right-hand side, it says the ICD-10 Information Central. Clever name, huh? Yeah, thanks. I like that. Okay, a couple of things you need to look at. One, questions and answers. All right, so it's divided into 2 sections. One is general questions about ICD-10, and the second is payer-specific questions. Okay, both will be relevant. In the first general questions, so then there's subcategories, and you can take a look at the subcategories. Depending upon where you are in the process, they'll make more sense to you. So for instance, you can look at general background questions. what you'll find is there's a list of questions. How are ICD codes different than from ICD-9 codes? How soon are ICD-10 codes going to be published for entry into our system? So each one is identified. You can click on those, and that will bring you to the CMS documents to answer those questions. So the first thing about the questions is, you know what? You may never have even thought of these questions, and these questions are important. So you can go down and look at the list of questions of that's what you need to know. And you can click directly on the link, and it will take you to the CMS sites that answer those particular questions. In the right-hand column, if the work group determined that there was additional resources over and above the CMS or some clarity that would be given to the answer, it's in the right-hand column. So you can scroll down, look at the questions as a way to start educating yourself of what's important about ICD-10, and immediately go right to the answers. Okay? So that's the general background questions and the category of questions for industry background. There are 5 question categories with questions in each. We arrived at these because providers submitted their questions that either on surveys to health plans or directly to One Healthport. So these are not made up questions. They're the questions that come from the provider community. The second category in here is health plans payer specific questions. So in this, these are questions, again from providers, that the work group sat around, talked about, determined how best to phrase it, and health plans will answer. They come into 2 flavors. One is the ICD-10 pre-auth questions, so anything related to pre-auth in ICD-10, and the second is ICD-10 claim questions. Okay? So how this works, and it's really pretty slick, is for a given question, okay, I'll read the question. Will your pre-auth policy and or your guidelines for requesting pre-auths change with the implementation of ICD-10? How will they change, and when will they be revised and published? Now, what's slick about this, for that particular question, if you click on it, all of the answers from every health plan will appear. Okay? So you can see what each health plan says. Now, if what you really want to know is you want to know what are Aetna's answers to all the questions, you click on Aetna, and all of Aetna's answers will appear. Okay? And if you really just want to look at one health plan for that and one health plan for this, you can click on that and get answers to it. So pretty effectively, you can take a look, educate yourself, and get the answers from the different health plans. So that's a resource that's available to you. Yeah, I encourage you to go out and take a look at it. Sure. So how you get there is you go to the One Healthport site. Under the One Healthport site, under Administrative Simplification Tools, under ICD-10 Information Central, these are the capabilities, the tools that are available. Click on Questions and Answers. If you click on Questions and Answers, you scroll down on this page. The top part is general industry questions, and the bottom part is the health plan specific questions. Okay?
Or you could print it off in a PDF.
Yes, thank you, Michelle. So if you don't want to look at a question-by-question basis, you can click to download. It will download a PDF. You'll have all the questions and all the answers in the PDF. Okay? You can also watch and see, do I have the most current version? So right now, the most current version is September 4th. Okay? So you may print it off September 4th, and you go in October, and they've got another one, then you'll know more answers have changed. Okay? So that's one of the resources that are available to you. The second resource that's available to you is document libraries, and as the work group runs across documents that they believe will be broadly applicable to providers, that will go in the document library. So if you periodically look at the document library, as you notice, there's only 3. Not that there's only 3 documents out there related to ICD-10, but we believe that these are the 3 that you may not know about or have access to that will be really relevant to what you're doing. So check the document library periodically. The third category is health plan ICD-10 preparation. I'm sure everybody is concerned and worried, are the health plans going to be prepared? Where are they in their preparation? So what this does is it gives you a table for each health plan. The work group sat around and defined what are the preparation metrics, might you say, and has developed a set of preparation metrics. So the first, it talks about what those. They fall into 3 categories: planning, remediation. Planning is, have you done all your plans for what you need to do for your systems and for testing? Remediation is, have you fixed the systems that you need to do so they go from ICD-9 to ICD-10, and then testing. So there's a number of different activities that they will report on. So you can check out what those activities are. Then let's take group health, and you can take a look for them, for each metrics, whether it's in process, completed, hasn't started. If it's in process, what's the start date, the end date, and the general barometer, are they complete, are they done, are they in process, and any specific comments they may have. So if you want to monitor where your health plans are through the process, you can go to this, and the work group will keep this updated to be current with the information that's relevant. So that's also on the website. And what will be posted as soon as the new website is up and running is a similar thing for the clearinghouses that are participating. So these are information resources that are available to you right now on the website, and I'd encourage you to take a look at them. So many more of the questions than you can ask today will be answered in these, on these information resources. Okay, so let's So Rick, how do I start? Right there.
Yeah, so now you're projecting.
Okay, so how do I go to?
Scroll down, just hit the key. Keep going,
Oh, sorry.
It's summer reruns. It's just
Okay.
keep going.
Palpable. The excitement is palpable. I can feel it. All right, so again, we're going to get to the point. You know the rules. So first, let's talk about some of the expectations of the questions. So again, you guys submitted a number of questions. We really appreciate it. The real focus on this will be preparation for ICD-10. So these questions are geared to preparation for ICD-10. They're not going to talk about how specifically you might code somebody that fell off the stage, left his glasses, broke his arm. Not going to talk about coding, but talk about how you can be prepared for when that situation happens, you're ready, okay? All right, so let's first meet our panelists. So I'll have them introduce themselves and the organization with whom they're with.
Hi, Evelyn Erdley, First Choice Health.
Hello, I'm Jessica Spytek with Primera Blue Cross.
Karen Warder, Family Care Network.
Michelle Lott, Washington State Medical Association.
Janine Lambert, the Everett Clinic.
Sarah Espanol, Regents Blue Shield.
Christine Kessler, Seattle Children's.
Elizabeth Beto, Cigna.
Okay, so as we go through and you answer, one request is always say your organization before you start, okay? So a number of the providers would like to know, as you say that, if anything's health plan specific, they'd like to know that. So if you could just repeat your organization before you answer the questions.
Bill, do you want any of
Oh, yes, so if you would pass out the,
I will. I know my instructions now.
Oh, our cars, yeah.
Health plan? Any other health plans up here?
Yes. Thank you.
One more.
Oh,
One more.
Evelyn.
there are not enough questions for
That's
all of the
right.
health plans yet. All health plans, as you know.
So
Given
Evelyn's
an
skating
opportunity.
now. You might count yourself lucky.
This is just for the lightning round. Okay? Evelyn would like to win that grand prize.
Yes.
Okay, so same thing. What we'll do is we'll ask the question, 15 seconds to answer, and then see if anybody has any follow-up comment that they'd like to make. Okay? So who has question one? Karen. Okay, Question 1. Does ICD-10 apply to me?
Yes. Family Care Network.
Yes.
I failed. Family Care Network, yes.
Okay. Anybody else want to comment on that?
Sure, yes. As a patient, as a provider, as a healthcare facility, any covered entity, it applies to us.
So any covered entity. Okay. Question 2.
I think this is me.
Okay. How will ICD-10 affect me?
So from Seattle Children's, going back to the how does it apply to me as far as if preparations are not adequately put in place prior to the cutover date, the basic impact will be to your cash flow. So the effect from a preparation perspective is going back to what the 2 prior speakers said, which is ensuring that the plans are in place today. So understanding impact to your systems to ensure that those areas where you're dependent on external providers, so a vendor for your EHR, so you have an understanding of how is the vendor. You know, I missed the instructions at the beginning, so I want to pass on this one.
Okay, yes. So the general
So I
instructions
need rule
are
refreshment.
in the lightning round. Everybody has 15 seconds to answer the question.
Well, clearly I lost that, so.
All right, and then there's an additional 5 seconds if they need to conclude, and then everybody else gets to add. Okay? My
Got it.
apologies. Okay?
Yes.
So, would you anything in the remaining 5 seconds?
I will pass, and I have another card here, so.
All right, fair enough. Okay, so again, it is a broad question. Would anybody else like to pick up where Christine left off and continue? How will it affect me?
Washington State Medical Association, it's going to affect you because it's going to be basing how your providers are reflected in quality of care initiatives, pay for performance, meaningful use, and a lot of other initiatives that are coming down the pipeline. It's not just a coding change.
Nicely done. Sarah, I saw your head nodding. You want to contribute anything?
I was just agreeing.
Okay. So any other additional comments? Okay. Who has number 3?
Janine Lambert, the Everett Clinic.
Cool. Okay. Can't I just let my coder handle it? Yeah,
You
that's
know,
the ticket.
I have 470 providers that say that. But I will tell you, your coders can handle a large part of it, the preparation, but it is organizational wide. We look at it as a regulatory project. It's a lights on, doors open, no glamour project, and it's not just a coder initiative.
Okay, anybody else want to contribute? Christine, you want to add to this?
The coders can only code what's documented. So just to reiterate, no, they can't handle it because if the documentation's not there, it can't be coded.
Karen?
Family Care Network, all of our providers select their own codes. So they don't do, the coders aren't responsible for that in ICD-9, so we won't be making that change for ICD-10.
So you just can't leave this to the coder?
Yeah.
No.
Bigger than that. Okay, who has question 4?
Michelle, Washington State Medical Association.
Will ICD-10 be more difficult than ICD-9?
I think the fundamental process of looking up the code is going to stay the same. The documentation is going to be more increased, and you're going to have delays and time. So it will pose challenges, but it is doable challenges.
Anybody else want to add?
I think this, Jessica Spytek from Primera, I think the challenges are different for the payers and the providers. So on the payer side, our challenges are all about, can we process the claims? Can we meet the same service levels? Are our systems adjudicated? And I think from what we heard, certainly from both of you, it's a different world. And I think the challenges that you will have in your organizations are somewhat different.
And Janine Lambert from the Everett Clinic, and a big part of it is making sure your documentation is complete and specific because of all the specificity in this code set.
So it seems a general message. It's not really the coding that's the challenge. The coding is the improvement and the changes that must be in place with the documentation so that the coding can be happening. So it's really the documentation that will really be affecting it. Next question?
Christine Kessler,
Okay.
Seattle Children's.
All right, cool. Won't my clearinghouse just make everything work?
Of course not. The clearinghouse can only process what you are sending them. So while you're dependent on the clearinghouse to be able to submit the claims to the payers, you need to be sending the correct information in your claims.
Other comments on that? Going once? Twice? Okay. Okay, now, all of those questions were really geared for the providers. So that's why the payers kind of took a back seat. The next questions are really related to the health plans. Okay, 6. Okay, oh, there's still a provider question. Oh, yeah. Okay, it's interesting to note that this question, person submitted with no name. Okay? What happens if I do nothing? Not there's an NSA out there watching these emails or anything, but what if I do nothing?
Janine Lambert, the Everett Clinic. 343 days from now, you will be doing nothing. You will have no reimbursement, and you will lose your ability to be able to file claims, to exchange data, to be in business. So I just have to reiterate, this is a lights on, doors open kind of project. So
I think what Janine just said is, if you do nothing, you'll be doing nothing. Anybody else like to contribute to that? Yeah, this is a must. Okay, question 7. All right. Will your websites have built-in coding tools that will allow the user to search for ICD-10 codes when entering referrals?
Sarah with Regents, and for Regents, the answer would be no, and we currently don't have any plans that require referrals right now at the moment.
Okay, and generally, can you, more broadly, for coding of claims or coding of anything, will you have coding tools on your website?
We haven't discussed having any toolkits or anything like that of that nature for codes. We believe that it's up to the provider to determine what codes to use and have resources available within their own organization.
Elizabeth?
Yes, for Cigna, we've actually been working on updating the website. We're in referral, the pre-auth, and then claim bundling and claim editing. We'll have the tools for ICD-10.
Jessica, Primera?
From Primera's perspective, all of our current systems and tools will be updated to accommodate 9s and 10s.
Evelyn, first choice.
We do not have coding translation tools, if that's the question. Our referrals require either a description or a code, so it's not just the code. If you don't have the code, you can give the description and we'll find the code, but no translation or coding tools.
So the general sense that I have is whatever tools are available today for ICD-9 will pretty much be available for ICD-10 on the websites, is a general sense that I get. Is that Elizabeth? Yeah, so that's a general sense. Okay, question 8.
I have number 8.
Okay.
Jessica at Primera.
Do you plan on conducting any type of provider education or training on revised processes?
We're not currently planning on providing training for providers. We're actively engaged in industry groups, OHP, and we'll keep our status up to date on what we are doing.
2 more sentences? You good?
Yeah, we're good.
Evelyn?
First Choice isn't planning on doing any provider training. We do educate through a newsletter. Our website has a lot of educational recommendations and tools. We go out and talk to our providers.
Sarah?
For Regents, we are sponsoring some ICD-10 webinars through Availity. That's happening this month. And we also have a section on our public provider website for ICD-10 information. So if anything's updated or any additional information is available, we'll put that out on our public provider website.
And Elizabeth, Cigna?
Yes, for Cigna, we have an FAQ on Cigna.com. We're going to put updates on the Cigna for HCP, and then we will also put information on our network news, which is sent on a quarterly basis.
Okay, next question, last question in the lightning round. How can I get set up to test with your health plan? Elizabeth.
For Cigna, we don't test directly with providers. We test with trading partners or clearinghouses. So if you would like to test, our recommendation is to contact your trading partners or clearinghouse.
Sarah, Regents?
For Regents, we actually already have a pretty large list of facilities and physician groups that we're working with for testing that will happen in 2014.
Jessica, Primera?
For Primera, our approach is similar. We have a very small select group of facilities and professionals who we are testing with. We have engaged them already and have actively started testing, and we will keep our various groups, either our websites or OHP, informed of our results.
And Evelyn, first choice?
First Choice is participating in the National ICD-10 testing program. We'll be testing with a few select critical providers and facilities, but we'll proxy test with all kinds of providers if they would like to.
Okay, so one of the things that came up that Evelyn mentioned was the national testing program. Raise of hands, people are familiar with it? Okay, so you might check out, yeah, I think it's National Testing Program is.
National ICD-10 testing program.
If you Google that, and it's an opportunity to engage in a broader testing thing nationally, which some of the local plans are also participating in. So you might write that down as National Testing Program, Google it. That's what Evelyn is referring to, and First Choice is participating in that process. Okay, so with that, we've now concluded with the lightning round. Move on to Jeopardy. Teresa is passing out more cards.
Thank you.
Oh my gosh, she's got hairs.
Oh, she's softy, yeah. Oh, wow.
Help! I want to get to the Jeopardy thing.
Please hold while we experience technical difficulties.
Actually, it's 4 user errors, really, what this is. No, like that one, yeah.
Here, you can have one of mine. Oh, my goodness, it is my lucky day. You want 5? She got 4 both times. Maybe you're gonna use it.
Okay. Now, we're all very familiar with the Jeopardy round. Let me repeat the rules. That random selection of cards will indicate the order of preference. The providers will choose from category 1 or 2. The health plans will choose from category 3. After somebody answers, they can A, choose to answer it, they can choose to pass, or they can choose to have a lifeline for anybody in the audience or a colleague. Okay. They have 1 minute to answer, and then a 15-minute follow-on round. So, who had number 1?
Christine Kessler.
Okay, so you get to choose a category and an amount. The higher risk, the higher reward. So,
Got it.
provider planning, they both go to, provider planning goes to 400, and provider internal operations goes to 500.
So let's try provider planning for 300.
Where should I be in my preparations for ICD-10? Where should I be now in my preparations for ICD-10?
I think this answer really depends upon the size of your organization. The larger your organization, the further along you will need to be, because the systems and the scope of what you need to remediate will be broader. So clearly Seattle Children's, large organization, we're much further along in our planning. If you're just starting, the starting point is to identify who's going to own this. So begin with a person that will be accountable for overseeing all of it. That can likely the person can wear many hats. It could be coding, it could be an IT person, or finance and billing. So the planning is the most important part. Have a clear understanding of where your external vendors are so that you can effectively remediate your systems, and then begin the planning and planning to include the systems remediation forms, reports, and documentation needs identified, as well as the training is a key component.
Perfect.
Much
Very
better
well
than the
done.
first time.
Okay. Other providers want to contribute to that or add anything? Good? Okay. Who has number 2? Elizabeth.
Billing for 300?
Until October 1, can we use ICD-10 as well as ICD-9? After October 1, can we still use ICD-9 along with ICD-10? And the third part, what about paper claims? Will you accept ICD-9 codes on them after October 1st? So, fortunately, the general question is, the magic date is October 1st. Can I use ICD-10 before that? And can I still use ICD-9 after that? And what about paper claims? Any difference?
For Cigna, we will only accept ICD-10 for services prior to October 1st. On and after October 1st, it would be ICD-10, and this will apply both for electronic and paper claims.
So ICD-10 only after October 1st.
On and after October 1st,
On in October.
yes.
What about ICD-9?
Prior to October 1st.
Okay, so for Cigna, only accept ICD-9 prior to October 1st, and only accept ICD-10 after October 1st. And that will apply for paper and electronic claims.
That's correct.
But that's for date of service, correct?
That's correct.
Okay, so good point. What Michelle brought up is that's for date of service. It's not the date that you billed, it's the date that the service was rendered. Has
Yeah.
to be that October 1st date.
Bill, it's date of service or discharge date. That's what we have.
Okay? Okay, so Evelyn, any addition on that?
No.
Okay. Jessica?
Primera is the same. We will be compliant with the CMS mandate, and that's pretty much it.
Okay. Regents, Sarah?
It's the same for Regents.
Okay. Okay, so next one. Who has 3?
I do.
Okay, you get to choose a category. Edit billing.
Billing for 200, please.
What if I need to initial bill or rebill for services that happened before October 1st? For how long after October 1st can I do that?
For first choice health, it would be 365 days, the timely filing period.
Okay. Primera.
Primera has not defined a cutoff date.
For Regents, for the initial bill, it would be the 12 months timely filing, and then for rebills, it would be up to 24 months from the date that the claim processed, and then Medicare, Med Advantage patients, it would be 12 months from the date the claim processed.
For
Cigna?
For Cigna, we will follow the 12 months timely filing as well.
Okay, who is the next one?
I do.
Okay. Provider planning or provider internal operations?
Provider internal operations for 500. Go big or go home, right?
It's a wild card. All right, so this means we get a question from the, first, Michelle, will you accept the question?
I will.
Okay, so any questions from the audience about internal operations that you might be concerned about, worry about for ICD-10? Right up here, a question in the front? Just if you wait, my colleague Teresa will rush the microphone to you. And again, this needs to be a broad question, not specific to a health plan.
Right. If you have to get a pre-authorization for services and you get it for a certain code, and then October 1st comes and the code is changing, then do you have to get another pre-authorization on that date, even if you had a certain amount of services, treatment dates that you were able to bill for?
Okay, so the general issue is she's gone out, she's done all the pre-auth requirement, she did it using an ICD-9 code, and now October 1st happens. Does she have to do something more? Okay, so.
Because the code's gonna change.
Yep.
Okay, so I am not a payer, and that's more of appropriate for a payer policy, but the answer to that question is on One Health Port's Information Central for each individual health plan. We did think about that when we were going through the prior authorization, as well as what happens when you have a period of time that covers the conversion date. So say you need to pre-authorize services that go from September 30th to October 3rd. What is the process? And I believe, correct me if I'm wrong, health plans, but it's based off of the time you request the prior auth.
Well done.
Okay. Any health plans want to add to anything? Elizabeth, you good?
Yes, for Cigna, if an authorization was requested prior to October 1st and the member is going to be discharged after October 1st, you don't need another authorization. We will go ahead and look at that. You only need that authorization given with the ICD-9.
Sarah?
Yeah, that's the same for Regents.
Evelyn?
For first choice, we don't require the code. It's either code or description, so there wouldn't be a worry that it was different.
Okay.
10.
So
The description would.
different health plans do it different ways. Some people are using the code, other people just use a description. So what Evelyn is saying is first choice, just use the description, so it doesn't matter.
Can I add a clarification to that?
After Janine.
Okay.
Janine, the Everett Clinic, one of the things you might think about is we're gonna start dual coding our prior auths before it goes live. So anything that we will be sending out for a referral or a prior auth or a referral or anything that we do, we're gonna put both code sets on beginning June 1st. So we feel like it'll give our employees an opportunity to practice as well.
Michelle?
The other thing to keep in mind is that in the prior auth section on ICD-10 Central, we did ask that question about whether or not I need to put a diagnosis code onto the pre-auth. And a lot of the insurers say, no, you can just do the description of the diagnostic service. And I know that's a little counterintuitive to how most of us process those authorizations currently. So it's something to keep in mind. You might want to change your internal practice.
So that ICD-10 Central will become a useful resource, you know? So I take a look at that. Okay, who has the next question?
Or is it 5?
I think it's 5. Okay.
I'll take billing for 100.
Okay. How will the transition to ICD-10 impact alternative care providers such as massage practitioners, acupuncturists, et cetera?
Well, I think the answer to that question is that come October 1st, for dates of service after October 1st, we will require that the claim comes in the door to us with ICD-10 codes for those dates of service. If they,
Even for acupuncturists?
yes.
I'm an acupuncturist. I thought I'd get special dispensation. Guess who's not going to win the grand prize today? So I'll ask that question of each payer, and we'll see.
So that's it.
Yeah. Elizabeth, you want to add anything?
No, that would be the same for Cigna.
Jessica, Primero?
If you accept medical insurance and submit claims, we require you to submit ICD-10
Okay.
codes.
The same for first choice.
Okay. And this is all true even though I don't get paid by diagnosis. Still have to put it on there. Okay, who has the next question? Yes, Sarah.
Billing for 300.
Okay. Okay, so we've already done that, I guess.
I think that might be used up.
Oh, maybe
400. Sure.
Oh, yeah. Where are the health plan clearinghouses in their preparations for ICD-10?
So for Regents, we've started doing connectivity testing with our clearinghouse Availity, and that started this month. And then we will actually start doing end-to-end user testing first quarter of 2014.
Elizabeth?
Yes, for Cigna, we've completed our remediation and we've upgraded all of our vendor applications, and we're working with our clearinghouses and trading partners on testing.
Jessica, Primera?
Premera has completed all of the systems remediation, And we plan on doing what we call end-to-end testing with providers submitting claims through clearinghouses to Premera and then back. We'll start that in April.
And Evelyn, first choice.
First choice, we've completed all the system remediations and are in the process of connectivity testing, and we'll start end-to-end testing within the next few weeks, two or 3 weeks.
All right, so there are two important things that came up on this. One is where are health plans? Only 4 are represented on the panel, but if you go to ICD-10 Information Central, it will give similar information for all of the health plans that participate in this process, of which there's national and local one. That's the first. Use Information Central. The other is a couple of terminologies were used here. Connectivity testing, end-to-end testing. So generally what's being talked about here is if you're going to submit a claim, the first thing is you've got to be able to connect with the clearinghouse and connect with the health plan and just get the claim there, okay? So as you know, a number of clearinghouses have health plan edits. So can you get your claim from your office to the health plan? That's one level of testing. The next is really process testing. You submit your claim, it's got to be processed, you get a remittance advice in 835 back, that's end to end. So starting from you, you send a claim, it goes all the way through the clearinghouse to the health plan and back to you in the form of an 835. That's end-to-end testing. So if you take a look at the definitions, that's what's being referred to in the connectivity and the end-to-end testing. Okay, so what's the next question? 7. Okay, so Karen, category and an amount.
Billing's all gone?
Billing is only for the health plans. So you get to choose provider planning.
Provider planning, what's the top?
100, 200, and 400.
Let's do 400.
Okay. I'm getting pushback from my clinic doc, who is asking why she should learn about new documentation and ICD-10 codes when they don't impact physician reimbursement, since that is still done by CPT or E&M. What do I say? Let me start the timer there.
Yeah. So the reality is if we don't use ICD-10 codes, a claim is not going to get paid. So that would be the first answer. But I think a bigger question by a lot of the providers is, you know, they're here to provide care for their patients, and I don't think they feel that this adds anything to the quality of the patient's care directly. We've talked about we're one of all the major countries who's not using this code system, and if we catch up with the rest of the country so that our data can be included as they do research, there's outcomes on the research that can provide better care for patients, and so long-term, it is a positive for our patients.
Anybody want to add?
I have 2 words: medical necessity. You need it. You gotta have it for your CPT code to get paid. If you don't get paid, regardless of what code you use.
So it's the diagnosis that gives the information about medical necessity.
A lot of the diagnosis codes provide the basis for medical necessity, if not just the beginning foundation.
Okay. And Janine?
Janine Lambert, the Everett Clinic. I'm going to put my compliance hat on. I don't know how many of you see Medicare Advantage patients, but there's a lot of regulatory requirements around having accurate diagnosis codes. We want to use diagnosis codes if they fall into an HCC category, and the documentation doesn't support it. It really creates problems for our health plan partners.
Yeah, Christine.
One last point, and that is around the external reporting. Recognize that a lot of the external reporting, you know, we're looking in the past, and what we do for 2014 and the start of this will be reported on in the future, so doing it accurately at the point of cutover is key.
Okay, who's next question?
I have number 8.
Okay, Jessica. So you've got billing for 500.
All right, I'll take it.
In anticipation that some health plans will not be ICD-10 ready by October 1st, the processing of crossover and secondary claims will be problematic. So this is a situation that you submit to Medicare, for instance, and they'll cross it over to the next, but it's also done in the commercials. How will you work with plans that you send crossover claims to that aren't ready?
Well, we're in frequent communication with all the plans in the OHP work group. We are part of the Blue Cross Blue Shield Association, so we monitor the status of those organizations as well as across the country and industry. And we will just monitor it very closely and understand who's not ready and who is.
Evelyn, first choice?
For first choice, for COB situations, I assume is what that's about. We are monitoring some of our pairs in the state and our other states, and so far, people are on track. So we haven't anticipated this happening. It may happen, I'm sure. To my knowledge, we will probably reject if they
Okay.
don't, it'll probably be a case by case, maybe. But we'd be rejecting if
Okay.
they don't build the right version.
Sarah?
For regions, we will be ready for IC10 October 1st. If we get claims that come the door from other payers or crossover claims that aren't in ICD-10 format, October 1st dates of service, we will reject those claims.
And Elizabeth?
Yes, that would be the same for Cigna. And in addition to that, we had been working closely with our trading partners as well to make sure that everything is working by October 1st.
Okay, so we are now out of time. So again, to award the grand prize, I'll go for each behind each person, and if you would give a round of applause because each one of them deserves it, and then we'll judge from the highest one who gets.
Okay, this one up here too.
So first choice, Ellen.
Teresa, I'll just give you this one.